I think we'll start with our lunch presentation. Looks like the presenters are pretty much done eating. So I'm going to invite Jade and Beth Petty to come up. We thought it would be good to spend a little time at lunch just getting a chance to hear from some people who really have been down in the weeds on a number of issues of relevance. Jade Petty is currently studying in the Honors Tutorial College, studying sociology in Honors Tutorial College at Ohio University. She's been involved with Youth Move Ohio since 2018. We also have Beth Petty, who's worked in education for 27 years. She's currently an early intervention specialist at Alexander Elementary in Athens County. And I'm sure she would tell you, despite all of that, her most proudest part of her life is she also serves as the mother of Jade Petty. So we have mother and daughter here today, and I'll invite you to come. I have a microphone for each of you, so you can just clip that on your lapel.
Oh my God. Let's see. Okay. Is that working good?
Yeah.
I think so. Hi, I'm Jade Petty. I am here to speak about some of my experiences moving through mental health systems from when I was a child up and through to my experiences as a teenager, which I think were the most impactful, positively and negatively, on me. And then I hope that as I describe my experiences and a few anecdotes, it can help to, it can illustrate sort of broader points about the mental health systems that we have, and hopefully get us thinking about ways that we can change them for the better so that people like me will have more adequate care earlier. I think the main point, and I'll start with this, is that care needs to be preventative, because once you get to a crisis point, your options are much more limited about how you can help youth. And then once I got to that crisis point, I was thrown into some really iffy situations. So I have seen a lot of the mental health systems. As a child, I started doing therapy when I was very, very young, and those experiences were fairly positive for me. And then when I was around 8 or 9, I started to deal more with anxiety, and I was struggling a lot more. So I ended up being prescribed medication, but it was not quite working for me, and my psychiatrist was continually upping my dose until I was well above the average adult dosage, and I was like 9 or 10. I'm not sure if my mom wants to speak on this more, so I'll be very brief with it, but we essentially got into a situation where we said, this is not working, and we were told, my mom was told, then it is you and your husband's fault that this is happening. And we walked out. When you have negative experiences in mental health systems, sometimes what happens is now the other care practitioners are even further away. So we were traveling about 45 minutes for these appointments, and we ended up then needing to go about an hour and a half after we had this negative experience, because it was very hard to find child psychiatrists that could take patients. And I think when you're in a place like Appalachia, there are even more limited resources often available nearby. And so that was something that I sort of, like me and my family, I think, came up against. So I think some of the other major questions that I ask myself are, is care accessible, or who is care accessible to, and what is the nature of that care? And I think that psychiatric care, mental health systems in my life have been equally harmful and helpful. I think that psychiatry can be very, very life-saving, and I think it can be a real stepping stone to getting people to where they want to be in their lives. But I also think that we have problems in our systems that end up harming people. So to sort of talk about that in the most direct way it's affected my life, I want to talk about my hospitalizations that I faced. So when I was 16, I was hospitalized at 3 different hospitals in Ohio in acute hospitalizations. And I still deal with the trauma that I faced from those all the time, every day. I think that for me personally, the experiences made me internalize sort of viewing myself as very sick. Once you are institutionalized, everything you do, that's a crazy person thing to do. Every thought that you have, everything you mention to a staff worker, like sometimes you see how they look at you and it's like, I am making a very basic comment here that has nothing to do with mental illness. I'm asking, for better care. And I am being looked at like I'm insane. And that is very painful, especially for a 16-year-old. So speaking about the hospitals more, my experiences were not positive. There were some very bizarre things that happened that I think that I should write a stand-up bit about sometimes, because they are very bizarre. A lot of times, I think there's high staffer turnaround. So staff are not trained to understand what might be harmful or helpful to an individual that is being hospitalized. For example, one of the staff-led activities was to watch a film called The Fourth Kind, which is a horror movie about, it's a found footage horror movie about aliens who come to your window at night and take you away and make people crazy, and it ends with an on-screen murder-suicide. So we did watch that film. There was a lovely 13-year-old girl there. The next morning, she told me she had nightmares and could not sleep that night. So you're in this situation, and it's sort of funny because you're like, how could anyone think that's a good idea? Like genuinely, it boggles the mind. And so there's things like that, which are just, I think, come from a lack of staff training. But then there's also things that are more policy-based. I think one thing that was very violating to me was that at one of the hospitals, I was strip searched when I first came. And I think it is a very scary moment to be in when you are being asked to undress by someone they were not a medical professional, they were one of the hired staff workers, and you cannot say no. It's very difficult to sort of explain that, and it also caused issues when I would try to come back to my regular life after institutionalization. My apologies. And I would struggle to explain to my peers what my experiences had been like. I struggled to sort of fit in because I felt very alone. And I think part of this is how it's set up. You drive 3 hours to the hospital, you're there, and then you leave and you never see anyone again that you met there. And everyone gets dispersed and spread out. So it's very hard to find community afterwards, I think. A few other weird experiences, and And it might be because I don't understand the risks of these things, but we were not allowed to have trash cans in our bathrooms in our rooms at some of these places, and we were not allowed tampons. So, my apologies, this is not a lovely lunch discussion, but we would have to wrap our waste and walk into the main, like, common room and throw the stuff away in there. And so as, like, teenagers, it's very embarrassing. It feels terrible. You hate feeling watched. It was to a point where I was dropped off a box of tampons and it was confiscated because of the risk, I suppose. And maybe I don't understand the risk, but it was something that was very difficult for me. I think there's one of the other main problems that I came up against in my hospitalizations was medication changes. I would be on medication and I would go into the facility and I would meet with a panel of doctors for maybe 5 minutes and they would recommend whatever they recommend to everyone. That might be a little unfair. I would then be on that med, go home, basically have been cold turkey taken off of my other medication, and I would go through drug withdrawal. I had a really terrible Christmas one year where I was very, very ill. I couldn't get up like from my chair because I was going through such severe SSRI withdrawals. So I think that is something else that can be very destabilizing. I think the other main thing that I want to say about hospitalizations is that I personally think it's egregious that we can have private for-profit companies that are chains of psych wards. In my experience and in my understanding, I think that it is the incentive to want profit and the need to have adequate comprehensive care are opposed to each other. That doesn't mean that it can't work ever, but it means that we've set up this system where to have increased profits, to be a successful business, you end up wanting to cut corners. That could be with the food, or the staff training, or the cleanliness. And I don't mean to put any individual blame, because I think that's wholly unhelpful. In situations like this is about how we have structured our policies to deal with children going through things like me. I think that a lot of my negative experiences were due to things that had happened because they were cheaper. And I think it is gross and it makes me feel very uncomfortable that there are just like CEOs that make a little money when you end up hospitalized. It's painful to think about all of the trauma that I faced, and then to think that there were people who were making very nice and comfortable salaries because of that pain. And so I want to make that point about how I think care should be structured and how it should not be for-profit based, because the incentives are opposed to one another. I think that what has been most life-saving for me, and what has been most helpful for me and what I love, is the relationship that I have built with my counselor that I have now, who I've been with for about 5 years now. Being able to access that care is, I mean, it's been like night and day. I feel supported. I feel like I have someone who is there for me. I feel much more grounded having that person in my community who I am able to talk to about things going on in my life or about my past experiences. And so I think there really is this transformative power that type of care can give you. And I also recognize the need for, I understand that there's a lot of nuance with all of these things, and there are people who are harms to themselves or to others, and they need intensive care. And I wish I had all of the answers about how to structure that perfectly. Unfortunately, I do not. So the main takeaways, I think, are care within the community is easier to access, time and money-wise. Institutionalizations can be very destabilizing, especially when you're then asked to just go do high school afterwards, and you're looking around and you're like, but I just went through all of this stuff. Like, how can I just be doing high school? It's very difficult. And so I think transitional care maybe is something that could be done, because I think that would have been very, very helpful, and helped me more academically. I want to thank everyone for listening to me, and I feel very honored that I was able to speak, and I'm going to turn it over to my mom now to talk more from the family member perspective of a child who is accessing care, and hopefully we'll sort of support each other in what we say, and we'll come to explain what this experience has been like for our family. Thank you. Do you have one?
Okay.
Top of your shirt.
Okay.
Hello. Is this working? Yes. So my name is Beth Petty, and again, I'm the parent of Jade Petty. I have been working in education for 27 years. I've been working as an early childhood intervention specialist for over half of those years. So I am a service provider myself. You don't know what you don't know. So back when Jade was actually a toddler and I took her to her first counselor because I did understand that developmentally we were struggling, but I didn't kind of have all this lived experience now that helps me really understand kind of on that perspective of what was going on. So, as a parent, first of all, I want to say it was very positive in hearing a lot of the speakers and understanding that through the years, and this is, Jade is almost 21, so we're looking at 19 plus years. The systems are hearing parents. They are hearing children. They are making the adjustments to, try to move forward in more positive ways. So I was hearing that within all these speeches that I was hearing earlier. Back when she was younger, in particular, that first counselor was the first time when it was like, there's parent fault. And then when I then take to the pediatrician, if you can just be consistent and do these reward systems, then your child will not act this way, parent fault. When I start getting her assessed more, because I was trying to puzzle the pieces together, and even in the written documentation, it's like, is the parent, teaching this child anxiety? My feeling about that for anybody that has a child that is really struggling is it's really hard not to be anxious. It's very hard not to be anxious. Jade mentioned the transitions. That's probably one of my main points is just still improving on the transitions. So one of the things that happens is when, and I heard this before from somebody, when you're told no at one stage, so for example, I tried to get her for music education, it was like a 504 when she was in 3rd grade. This is a child who's incredibly bright, was not a behavior problem in school, so it wasn't affecting her school. But so I was told no then, so the system was kind of like not serving the way at the time. I didn't know about all these other resources I could have pulled in to try to, help them understand better at the time. But then it took a while when I was told, no, I can't receive services within the community because I did not have Medicaid when she was younger. And so then we are traveling this hour and a half to see services. And all of that time, this is a very bright kid, that's triggering. That whole travel was triggering for her. When we went out of the community, they couldn't say, hey, I know there's like this ceramics class here, and that might be helpful, because they didn't know anything about our community. So, and so that whole importance of it being community-based, and then also doing better with transitions is the main points that I wanted to put across. So when she was in 5th grade, she had suicidal ideation. At that time, people wouldn't think of 10-year-olds as much. I mean, I'm sure all of you probably knew that, but within like the broader community, that was not necessarily an accepted thing. Again, we are looking back to the past and now to the future, and I will say that that is absolutely accepted now within the education. We get all trainings and stuff, and I hear it, and so people do understand that even at a young age, that is occurring. Middle school got even harder because the academics got a little harder, even though, again, the schools couldn't quite understand because she was in all these hard classes and getting A's, but the social stuff got harder too. So then us not having, except for what I was seeking out, us not having any kind of preventative care for her, even though she was red flagged. I had teachers that red flagged her. Again, doing fine in school, not a behavior problem, but there were red flags that came up. Eventually it was, the crisis happened and she couldn't go to school. Then she just couldn't go to school. And it took over 2 years to get her to get back into where she should be as for a child her age. And she was doing awesome, right? She was then doing theater, she was doing chorus, she was involved in Youth Move, she testified as a youth to the Ohio Senate, she was involved in the governor's committee, she was doing all this wonderful stuff. So we're very grateful because once we got connected to services, then slowly she built up a tolerance, and then she used her lived experience to kind of want to help others. But where we got connected to services was community. Once we could get to the community. So when she was, I'd already been told no because we didn't have Medicaid, but then as a mom who is just seeking out those puzzle pieces and like, how do we get these services? I just called again a local service and they were like, yes, now we will like serve you. And I think some parents, they get, shut down along the way and they don't think to recheck in. So I think it's very important to kind of like recheck in as a parent. Like, even if 3 years ago this was a no, is it still a no? So that, once we got connected to Athens County Family and Children Services, or Athens Family and AFCFC, right? And, it's just those little things. So Wendy Shields at the time was the director of it, and she doesn't remember, but she did, because she kept telling me she didn't remember. She gave me the application for the Youth Move when we were in one of the sessions. And so Jay got on the state council. Again, her doing these things that she felt were advocacy, that people were saying, yes, your voice is important. That was all part of her healing process. So, but also just connecting to those, connecting to the local community, continuing to build on that, and getting connected to counseling and psychiatry that is within the local community. feel very blessed because it is still very difficult because, as we know, there aren't as many providers as in that field that we need to be. Another thing is just, in a sense, with the counseling, that was one thing that we could access through our insurance. And so what was very helpful for me as a parent was Jade had counseling, which in the beginning she had me participate in with her. But then also my husband and I had counseling with that same counselor that just kind of helped us kind of reframe things and understand things better. And again, you don't know what you don't know. So that counselor really helped us kind of understand how to help, Jade within the system. So one of the things I would say to a parent too is if you find someone who has a child who's like 10 years older, who has been through the systems and can give you support, because now I act as that for families. Within I act as that for families just within people that I know, but even within my job, because of all my lived experience with Jade, I support families and I support them and through going through the systems and figuring out if this system is not the one that can serve them, then what system can serve them. And we've been very successful in that sense. I did want to say that just real quick regarding the hospitalizations is Jade is just now bringing up traumas from those. So she kind of buried them. So we're kind of dealing with all that just now, which is why probably her speech was mainly about that, because now they're coming up and now we're dealing with, we're addressing that. In all of this though, it's very different than 5 years ago. It's different than when she was a toddler because we are connected to all these services and she has her own agency that she brings up ideas and then I have ideas and then we talk to her counselor and her counselor says, okay, this brings up ideas for this. And so being connected to all those community-based services is extremely important. So preventative care and then transitions. I am fortunate that I work at Alexander Local. I know the time. We are a model district in the state of Ohio. We are a health model. We actually have like 70 acres, and we are fortunate because we serve all of our students pre-K through 12 on the same campus. We have addiction recovery services, Hopewell Health. We house them within it. We have, I'm not going to name everything that we have, but Holzer Health, there is on campus, there is a clinic there. We have a ARC, which is the Alexander Recreational Center that the community can access. I personally do the pollinator garden, huge pollinator garden, and the land lab. And Rural Action which is the community base, they support me in all of that because not only within the classroom, of course, all of that getting kids out in nature and all of that extended mental health stuff is important. So, and the thing is my district is very supportive. So when I said, can I put a garden right in the front where everybody can see it? And maybe sometimes I don't quite get to it. And they were like, absolutely, So we feel very blessed that I am in this situation where we are kind of like the services in a rural area. The schools are so important. But still those transitions don't quite happen. In special ed, I serve two, early intervention into preschool, and preschool into school age. And our hands are tied sometimes. So the communication might not quite be there like it needs to be. My students leave me, and then there still is that I don't really have time to talk to that kindergarten teacher that much unless we find our time, right? So there's still those transitions that need to get better. In the state of Ohio, this is my soapbox. In the state of Ohio, for preschool we have developmental delay category. It ends at preschool. So we have these red flagged kids that we know we want to give them more support when they get to kindergarten, but we cannot give them a developmental delay. So our choices are emotionally disturbed, which they don't really qualify for because it has to be over time, even if I've had them for 3 years. a lot of teachers look at that and it's a negative thing. So we don't really want to give that to a kindergartner, right? Because if that child moves systems, we don't want them to look at that and say that's their category. So anybody who is able to make policy in the state of Ohio, if you look at Louisiana's, beautiful, that developmental delay extends to age 8. If we could have that, that would help us with our transitions. It would give some of those red flagged kids those preventative supports more. And so, yeah. So anyways, every year I come up against that where I wish I could give a kid a developmental delay as they transition to kindergarten. So again, community-based. We feel very blessed. Athens does have so many in this area. Not everybody can access it because a lot of times it is you have to have Medicaid. And so that is the other thing that we need to do is figure out how families like ours can access services without having to work so hard to do it. So thank you. Oh, yeah, sure.
Yeah, we do have a few minutes if anybody would have any questions or anything you'd like to offer.
Okay. Yes. Okay.
I guess,
Oops.
Yeah.
you spoke about wishing there was a transition, like that you had a community
Yeah.
youth in
Yeah.
that space that you can connect to. Have two things. So can you give me an idea or two of what that would have looked like? And then second part of that is, have you found that community now?
So the question was about the transition, and does she
Yeah.
have an idea of what that would look like and how she found the community now?
Yeah, I think it is difficult to imagine possible futures sometimes. And I think that's part of the creativity that can be really helpful within sort of a variety of like jobs within the mental health systems. I think that speaking to other people who had been who had been hospitalized, would have been very helpful. I think that it is true that only recently was I sort of able to speak publicly about these things, but I think that I do remember one time I was speaking about these it was an interview for a program which I adore called the Margaret Boyd Scholars Program at Ohio University, which I'm in and I love. And after this sort of group interview, I had just briefly mentioned it, another person who was in the interview with me came up and said, I went through the exact same thing. And we walked back to our dorms and talked about it. And that was like one of the most healing things maybe ever that had happened. And I had no idea it was going to happen. So I think if we could create opportunities for that to happen so that it wouldn't have had to be sort of serendipitous, I think that would be really helpful. I don't know if that would look like community support groups, maybe even, we have all this wonderful technology now. So I think it might even be easier to connect so long as people have access to the internet, which can also be a barrier to care. So yeah, something peer-to-peer. And I know with Youth Move, we've been working on getting peer-to-peer, I'm not sure.
Youth support.
Youth support. And so programs like those I think would be really helpful.
And I can speak a little bit on that because one of the things is I'm fortunate because I'm one of 6 kids, 4 are in the service industry. And so I had a counselor sister, I had a brother who is a school nurse, and then also he is his son, my nephew, completed suicide when he was 16. So it was 9 years out for my nephew. So eventually I did ask for my brother's help, but he is in Las Vegas, and they have 350,000 students in their school district. So all of their nurses become like these specialists, and so their district had a lot of things in place that in Appalachia our districts did not. And so like transitional forms, like kind of understanding like, okay, here's a kid getting out of the hospital, and then what, you know, just going through with people within the district, and you know, basically just filling out a form to get some information, because it is like there's your hospitalization, and okay, now on Monday you're supposed to go back to school, even though, like she said, you're often physically ill, you know, and everything. Mm-hmm. So I think too, like just trying where is this child going next? Yeah. And so how do we connect them to that system so that we can kind of understand that transition better? So he did share a transitional form. I did get her district to work on it. It was helpful, you know, in that sense too. So yeah, but that's kind of an idea too with that. Yeah.
Thank you so much for sharing.
Yeah, of course.
I noticed there wasn't group therapy, like outpatient group for adolescents, like it just, in that peer-to-peer, we could elevate that like in the region. I think that would be super helpful because we can hear that other youth voice.
Yeah, absolutely.
Are there any efforts to create sort of youth consumer spaces that are not HIPAA protected, where people could sort of wander in and get the kind of peer-to-peer social engagement, you know?
So the question was, are there any are there any efforts for creating youth spaces that are not HIPAA protected, so that you know, the youth can support each other? And I'm not the one to answer that, but
I think there are a few maybe, but I'm not sure if that's the type of programming they have.
I know.
I'm not sure if there's representatives from those here.
Right. So I know this is the other thing, like as a parent and wanting to connect her to services, I still don't understand everything that's in Athens County, but I do know next to, there's a new, I think it's maybe not for her age, but there is a youth center that's next to what is that restaurant?
Tavoline House?
Does anybody know what that one's called?
Is it run by Sojourners maybe?
Possibly,
Yeah, I believe there's Sojourners.
And then there's also the, what's the one for the adults? That's the house. That's, the gathering place. I mean, so the other thing is that, I mean, we do sometimes you just put out that there's all these different resources, but that child can't access those resources yet, you know, or within themselves, or they have to figure out what works for them to kind of do that transition, and that does happen with Jade, and so, but all those places are wonderful. Go
You'll
ahead.
have to repeat this, but
Yeah.
contacting the 317 board or the
Yeah.
local ADAM board.
Right.
I mean,
Yeah.
if a resource doesn't exist, you know, youth-related services that are peer-to-peer do exist in some parts of the state, and so being able to tap into the board network to understand what's working well and where, that might help build some ideas, you know, locally.
Yeah, absolutely.
Okay, so I should repeat that? No. Okay.
We had a mic. We were mic'd up.
Yeah.
I have one more question
Okay.
if you have time. So I'm curious, you talked about your experience with being prescribed medication.
Yeah.
Did you find during any part of your journey or now that you have had experiences with prescribers who listened to you when you said your medications weren't working for you?
Yeah, I sort of feel like it's taken many, many years to find the right people for me. But now I feel very secure with my care practitioners, and I feel that I'm listened to. And that is after trying many different things, I've sort of settled into this where it's, one, a lot more stable, and two, I feel more valued as like an individual when I'm like getting care.
I think that, as the child gets older, they tend to be able to advocate for themselves more. So, and so that kind of happened with her. She's incredibly great at like giving you metaphors to help understand. And so, she kind of helps all of us understand so that then we can try to put the puzzle pieces together still, in that sense.
I think it's important, and I hope you're talking about that. Like, I think sometimes in many spaces we're ignoring youth voices. They're trying to tell us that their medications aren't working, right? And because they're young, we're struggling to understand, like to your point, understand what they're trying to tell us. But I think, in the work that you're doing, helping other youth learn how to do that earlier on.
Yeah.
Then as a parent, making sure that, we're letting parents know that they can demand that their child's voice is heard in those conversations.
Absolutely.
So, another, I don't want to take too much time, but one of the things that I do when I'm trying to connect my families to services, and oftentimes it is the pediatrician that I send them to first, is I advocate to them, do not talk about your child's struggles in front of your child. Because that was happening all through. It took me a long time to realize that I could advocate for that. Because even though she was 5, she understood everything. And then this whole shame, like that was the thing that I didn't understand as much. Like, how do I help my child not attach shame to all of this?
I think that what would happen when we would try a different like care practitioner is you do the intake. And I have done many intakes in my life. And it's very easy as a child to and as an adult to internalize that, and then sort of turn against yourself and pick up negative thought patterns based on how you feel defined. And so that is something that I think it would have been nice at the time to have understood. And that's why I think advocacy now is really important to me, because I hope that I can sort of spread that to other families and just maybe make it a little easier.
And I think too, when I was saying, you don't know what you don't know, well, it is just lived experience, but now I do know a lot more. So now, because I work with 3, 4, and 5-year-olds, that's when I started her in the systems. Now I have so much lived experience that I can guide them really well. So listening to the youth, listening to the parents with lived experience, that's really what we need. We do need to do that. I do advocate for that. So I appreciate, because I know this is a group that does do that. So, yeah. Okay, thank you.
Thank you.
Yeah, thank you both. I mean, a wonderful grounding of everything we're talking about here today.